Fifth disease, also known as slap cheek, is common amongst children and can also affect certain adults upon exposure to the virus. Fifth disease is caused by a viral infection, namely Parvovirus B19. This is a virus that commonly infects humans. Fifth disease is spread when an infected person talks, coughs, or sneezes small droplets containing infectious agents into the air. The droplets in the air may be breathed in by those nearby. Infection may be spread by contact with hands, tissues, and other articles soiled by infected nose and throat discharges. Infection may be transmitted from a woman to her fetus. Once the rash appears, the person is no longer infectious. An exception to this is in infected people with immune suppression, who may remain infectious for months. Common signs and symptoms of fifth disease are as follows. In children, cold-like symptoms develop early in the infection. Then 2 to 5 days later, the child typically develops a slapped cheek rash on the face and a lacy red rash on the trunk and limbs. The child usually is not very ill, though the rash may occasionally be itchy. The rash disappears after 7 to 10 days, although it may come and go for several weeks, often in response to heat. Adults may also be infected with fifth disease and may have no symptoms, or may have the typical rash of fifth disease, joint pain or swelling, or both. The joints most frequently affected are the hands, wrists, and knees, usually on both sides of the body and usually getting better in a week or two, though sometimes the pain and swelling may last several months. With fifth disease, the treatment options are limited as the condition tends to fade away on its own over time. However, there are treatment options available to ease the side effects. In children, fever and joint pain can be eased with acetaminophen or ibuprofen. Adults would have to modify their activities, take frequent breaks in between, and rest when they encounter joint pain and swelling. Taking non-steroidal anti-inflammatory drugs such as aspirin or ibuprofen would help to relieve these symptoms as well. The most expensive approach is a 15 ml oral suspension of ibuprofen, which costs $11, while the least expensive therapy would be receiving a vaccination of intravenous immunoglobulin, which is funded by the Australian government. Alternatively, there is no need for treatment for patients who do not experience any symptoms, as the body fights off the virus on its own over the span of 1 to 3 weeks. The first point of contact when seeking the aid of health professionals would be a general practitioner. The general practitioner would be able to diagnose the condition and provide advice on how to treat the condition based on the severity. If the condition worsens in a child, a pediatrician would be involved so as to ensure that the child receives more detailed care. If the infected patient is a pregnant woman, engaging a gynecologist would be advised. So as to conclude, fifth disease is not a life-threatening disease, as it usually gets better after 1 to 3 weeks. The viral infection generally goes away without treatment if the infected individual is generally healthy. Cold-like symptoms, slap cheek appearance, and mild rash development are all signs of fifth disease. On recovery, the infected individual develops lasting immunity and is protected against future infection.